welcome back to American Agenda. I'm Allison Maloney, along with Bob Sellers. More than 100 workers at a Houston hospital sued after the hospital demanded that all staff get the COVID vaccine. But now a federal judge has sided with the hospital, saying federal law does not prevent the hospital, Houston Methodist, from requiring all of its employees to be vaccinated in order to return to work. The hospital staff says they will appeal their case all the way to the Supreme Court. So should an employer be allowed to demand workers get the shot? Let's bring back our all-star panel of co-hosts today. Jessica, what do you think?
Look, the courts have spoken. Companies are free to set whatever workplace policies they want, and they do it all the time. Drug testing, alcohol sobriety checks, and the decisions that the employer makes are not always going to be popular, but it is what it is.
Yeah, and Ford, I mean, they are working with patients. This is a hospital. So do you agree with what the hospital laid out, or do you think that they should continue to fight this and go to the Supreme Court?
Well, let me put it this way. I could argue about should all day long till I'm blue in the face. And I think a couple of months ago, Bob and I had a discussion that this was coming down the pipe and employers were going to do this. Look, in general, unless you're part of a union or you've got a really great contract that you negotiate with your employer, unless you can demonstrate a religious exemption, which is going to be really hard in this case, or a medical complication exemption, most employees are going to wind up being forced to take the vaccine, whether they like it or not. What I do find interesting here in this particular case in Houston is that the argument wasn't about whether or not they should. They're making the case that the vaccine may not be entirely safe, and they were trying to go to the health complication route, and basically the federal judge knocked them down. Look, I believe in making sure that we draw out the law. So going to the Supreme Court, I'd like to see how this plays out, but I have a feeling that the employees at Houston Methodist Hospital are going to come out on the short end of this stick.
Melanie, your thoughts?
I think that if they're at-will employees, they're pretty much stuck, because that, of course, that means that you can be fired for whatever reason. I happen to be an educator, so I don't know if this will apply to people in education who are tenured educators, whether or not they can make them take the shot or not. Like if you have if you're under contract, have a union, as Ford mentioned, whether or not they're going to be able to enforce that. It's interesting that they offer the flu shot to educators every year, and they don't make us take them. So they offer us the option. So how is coronavirus much different than that? Thousands of people die from the flu every single year.
Yeah, Bob, Melanie brings up a really good point. I think it comes down to, will we start seeing this in the schools, right? They do have a union and a contract, but will we start seeing schools require teachers to get vaccinated and other businesses?
Well, and that's a government entity. So I think it's an easier decision when it's a private company, because kind of like Jessica said, you may not like it. It may not be popular, but that's what happens. But as Ford mentioned, the argument here is this was emergency use only, so you're exposing us to a risk that we shouldn't otherwise be exposed to, and I think that's a valid argument. Having said that, I would like to see the employer say, we'd like you to get it, you don't have to get it, but we strongly encourage you, and we'll leave it at that. The difference here, though, to me, the difference is it's a hospital. So it's possible. It's one thing if you're working in a building with other people, lawyers, or you sell tires for a living, whatever it might be, you're working in some sort of area, and other people might get it, but they have the option to get the vaccine, or they can refuse to. And you go with whatever the risk is. But when you're in a hospital, I can understand them trying to limit as much as possible the risk associated with what the people are exposed to. But I do think it's a better discussion, though, should kids have to get it? And I'm not crazy about that, because, again, Ford, you're talking experimental. I'm not crazy about that.
Yeah, that's actually...
Go ahead.
No, go ahead.
Ford.
No, I agree with Bob here. Look, we are talking about FDA trial approval, and we don't yet have full approval. Usually that comes after 35, 36 months. And when we're talking about children, those who pose the least amount of risk in terms of getting COVID and dying, I don't think it's a good idea to play with those. And I think we should leave it up to the parents to decide for themselves. I do hope the parents get it for the children, but if they don't, I understand, and their rights as parents and their right to be doing that.
Yeah, Jessica, I wanted to get your take on that because, businesses are one thing, but in Massachusetts, kids had to get the flu vaccine in order to go back to school last year. So I have to wonder if that's going to be the case with the COVID vaccine.
I agree with what Ford just said. Look, this is all about parental discretion. If you have a child and you want your child to be vaccinated, more power to you. And if you don't, I don't think it should be a requirement. They're the least at risk of the population, and it shouldn't be required.
Melanie, you're in the school system. Your thoughts?
I am. I'm in the school system, and I'm kind of on the fence on this, but I do think it's a parental decision. But on the COVID vaccine, I'm not on the fence. I think it's experimental, and a parent would be absolutely nuts to subject their child to that, especially being young and having no idea what the future holds as far as long-term effects for that vaccine.
Yeah, have you
Yeah,
seen
Bob,
the reports,
go ahead.
Allison? Have you seen the reports where everybody that gets the vaccine is going to die in 2 years?
I haven't seen that.
Yeah,
But-
yeah.
but
By the way, I'm not saying that's true in any way, shape, or form, but that's the kind of conversation you get.
And we have started to see some things where kids are having enlarged hearts after getting that
Yes.
second shot. We've talked to doctors about it. So I think a lot of parents like Melanie are on the fence, and it comes down to, will the schools make the kids have to get them. I know in Connecticut, they did away with the, you didn't have to get vaccines due to your religious beliefs. Well, they got rid of that. And then they actually had an event there, a rally, to try and get people's rights back, their health rights. So we may start seeing this in other states, but I think parents, we're fine taking the vaccine. When it comes to our kids, I think, we get a little weary until we start seeing, what can come down the pipeline and some more studies.
All right, we're going to leave it there for that one.